Good evening, welcome, and thank you for everyone for coming to this virtual introduction. I want to introduce myself. My name is Michael Robinson. I am joining Southeast Orthopedics. Tonight it's casual, just me introducing myself, and then I'd love to answer any questions that you may have, and you can just put those into the question and answer at the bottom of the screen. Again, my name is Michael Robinson. I'm a joint replacement surgeon at Southeast Orthopedics. Some of my background is I'm originally from Missouri. I grew up in Missouri and went to the University of Missouri in Kansas City. I went to the medical school there, and upon graduation, joined the United States Navy. During that time, I was sent to many different places around the world, but did my orthopedic residency at Naval Medical Center San Diego, and then finished that and completed that tour, and then went to Okinawa, Japan. After that tour, I had the opportunity to do a subspecialty training in joint replacements at the Hospital for Special Surgery in New York City. Excellent opportunity to see a high volume and complex joint reconstructions. Following that training, I joined the Naval Hospital Jacksonville here in Jacksonville, Florida. During that time, I was able to start the joint replacement program for many of our retirees and active duty, and was department head for the orthopedic surgery department. I also was selected for the president of the medical staff, and eventually became the chief medical officer of the Naval Hospital Jacksonville. As during that time, I was given the opportunity to go to Afghanistan, and was department head for the orthopedic surgery service and care for the combat casualties. After that time, I was brought back to the Naval Hospital Jacksonville, and then did some work with the University of Florida Health as a joint replacement surgeon for the last 3 years while I was on active duty. So opportunity to see both patients with a complex of the inner city, as well as patients at the Naval Hospital. I now join Southeast Orthopedics at our new location, which is in Riverside, is at the St. Vincent Riverside Medical Center, and it's called the Riverside DePaul office. It's in the DePaul building. It's 2 Shercliffe Way in Suite 605. This is a new office for us, so many of our patients may be familiar with the Riverside office across the street from St. Vincent's. This one, however, is within the hospital. I am joined into this practice with Anthony Biello. He's a physician assistant with orthopedic fellowship training, and he joins me from the Navy as with his training as both a physician assistant and specifically with joint replacements, and I'm honored to be able to work with him after our military careers. To give a little background in regards to what I do, my expertise is in hip and knee arthritis. I do both hip and knee replacements, but we also provide care in regards to non-surgical treatments. Many patients may have pain in their hips or knees and not know whether a hip replacement is the better option for them. And that's where we can give those discussions in regards to what's better, a hip replacement with surgery, or a knee replacement with surgery, or other non-surgical treatments if you're not at that level of arthritis or ready for that position in regards to your care. Secondary to my subspecialty fellowship training, I was able to get extra training within revision, hip and knee replacements. So patients who have had a hip or knee replacement, who have pain, instability, or some other dysfunction, we were able to evaluate those patients and provide care, whether it's surgically and non-surgically, for their hip and knee replacements. Some of the technology that I bring, some of the special training that was provided to me, as well as what I've acquired over the years, is I do robotic assisted surgery, also called Makoplasty. I've been doing that here since 2018. We also provide oxynium implants, which are known for their increased longevity, as well as hypoallergenic properties for specific patients. Partial knee replacements, also known as unicompartmental knee replacements or patellofemoral replacements, also do those trainings both in the robotic and the non-robotic approaches. One of the things that I did while I was in the Navy, I also provided a rapid recovery program, and we can continue that with Southeast, which also includes same-day surgeries. The days of being in the hospital for several days with the new techniques and the new technology, as well as medications and physical therapy, patients do not need to be in the hospital this long, and we provide both same-day surgery as well as short stay in regards to hip and knee replacements. This is some of our contact information. And at this point, I would like to hear any questions or answers that you may, questions that we may answer for you. So a lot of patients with hip arthritis may have other arthritises, including spine and knee. The interaction between the spine and the hip is not uncommon. Typically, it depends on the clinical exam. Patients can have pain from both areas that can affect the same area. In other words, you have spine pain from neurological pain or from the hip arthritis pain can overact. So really requires that clinical diagnosis, that examination to figure out what is the better thing to do. Is it better to proceed with the hip or better to proceed with the knee? And it really depends on what the patient and the physician feel is the most appropriate in regards to what's going to give them the relief of the pain. So the hip replacements, there are different approaches that we do to get to the hip. So the ball and the socket, it's being within a muscular envelope around that. And there are different approaches that we've been using for many different years. The most common that you hear about today are the anterior approach, or called the direct anterior approach, or the posterior approach. I do both of these procedures. I think there are advantages to each one, and it is dependent on the patient. And that's an honest conversation you should have with the surgeon. What is the better option for you in regards to what your condition is, what your expected outcome should be, and what activities you want to do? They both have advantages, and those are the two most common. Now, muscle sparing is typically a term that is used, but function-wise and longevity-wise is in regards to what you're expected in regards to relief of pain. The number one expected outcome after hip replacement is pain relief, and the function that goes along with that. But I think that what you hear about is the anterior hip approach most commonly. That has advantages, and that's that discussion you should have. But really what it is just a way that we get down to that hip joint and how those implants are put in. So the most common recovery time is usually between 2 to 4 weeks. Most people can go back to work if they're doing more of a desk job around that 14-day plus mark. Some patients can go up to four weeks, and almost majority of patients, 99%, by 6 weeks are back to that. I mean, especially with a hip replacement, those recoveries are very quickly, and patients recover very quick in regards to getting back to that level of activity. But the biggest indicator of how fast you can get back to those activities is your pre-surgical activity level. Trying to increase your activity level allows you to be able to recover. And I tell people it's like this. If you go to the gym and you start working out in the gym, you're going to be sore. You're going to have soreness from that workout. Imagine doing that exercises after you've just had a joint replacement. You're going to be sore from not just the therapy, but also from the surgery. So we encourage you to do those pre-surgical exercises to improve your function that allows you to have improved outcome. So approaches to pain management, we use a multimodal pain management. So we use both medications, non-medical evaluations. We use intra-articular injections. All these things can work together to allow you. The number one thing is we want to get you up, get you active. We want you to be as clear-headed as possible, and that allows you to be able to do those things in regards to physical therapy and make decisions without feel like in a drug status, but also be able to be controlled in regards to what your pain is. So some of the straightforward answers, it can be multiple things. First is arthritis. That is the most common. So majority of surgeries for joint replacements are done for osteoarthritis. There are other types of arthritis. But the key to this is correlating what we have for arthritis is actually the cause of the pain. Pain in a joint may or may not be coming from the arthritis, but we know that the joint replacement will help with joint pain. So if there's other pains like we talked about in regards to nerve pain from the spine, doing a joint replacement may not improve that pain because it is coming from a different source. So it's making sure that the pain source is something that can be relieved with joint replacement. Absolutely. Like many people can have joint replacements or arthritis in different locations. So a hip replacement, a knee replacement, not at the same time, but I recommend it. But yes, you can have them. So the most common partial knee replacement is called a unicompartmental arthroplasty or replacement, where we replace just one area of the knee. So the area has both an inboard and an outboard side, but we would just replace that area where the arthritis is most severe. Yes, I do perform that both with and without robotic assistance. The robotic program allows us to provide precision in regards to where that unicompartmental or partial knee replacement is placed. So most patients are candidates for a knee replacement with robotic assistance, so, or the Makoplasty. Patients who've had prior surgery in regards to an arthroplasty would not be a good candidate, but if you have a knee that's never had a replacement on it, robotic assisted surgery is an indicator for many patients. So afterwards, yes, everyone goes to physical therapy. I think to improve, again, pain, but also to improve function that allows you to have more rapid recovery. I do like to send patients to physical therapy before, and the reason is that does prepare them for the surgery. It allows them to go through some of those exercises before. So preparation is the key to success in regards to joint replacements. So the simple answer is most patients after surgery will be placed on some type of narcotic or pain medication that you cannot drive on. So the answer that I always say is if once you're off that pain medication, that is be the first indication that you can drive afterwards. Because you want to be able to, and everyone else wants you to be able to be cognizant in regards to how you are driving. But that's the number one indication, is that tells you your pain and your function is getting to that level. Depends. So it depends on what type of work we're talking about. More desk type of job, patients can typically go to back sooner. Some patients are able to go and do work from home. And that is obviously earlier than patients who have to get to work. And that's usually the biggest challenge, is getting to work, whether you need to drive, as we discussed before, or have someone else take you to work, but also that allows you to dedicate your recovery time in regards to physical therapy. Those are the keys. But most patients, if they're doing more manual labor, it could be between 4 to 6 weeks. Hip replacements are probably the #1 successful surgery out there. If you look at all the surgeries that have been done in regards to percentages of improvement, specifically for pain, hip replacements have by far over the last 40 years been the most successful surgery that we do. And that can be up to 90 to 95%. So predictability of longevity depends on a lot of factors. The current technology that we have shows that the majority of patients, up to 85 to 90%, will have their joint replacement for 20 years. And that's very good. But the factors depends on how you take care of it. I tell this to my patients. How you drive a vehicle will indicate how long it will last. If you buy a new car, asking the dealer how long is this vehicle going to last, they're going to say the same answer. It depends on how you drive it, depends on the quality of the vehicle. And so those are the things that I look for. I look for, when I do a joint replacement, I look for the implant to have durability, longevity, predictability, and that way they have a proven track record, so you can know that when you get a joint replacement, what you can expect for longevity.